So, very warm welcome to this special session on annual health checks. I'm Sue Jane, I'm from Healthwatch Enfield, and I'm really pleased to be here with our friends at One-to-One to give you this information session with some fabulous speakers who I'm going to introduce to you now. We've got Chris O'Donnell, who's the Person-Centred Planning Coordinator. Thank you, Chris. He's giving us a wave if you see where he is over there. And Priscilla Surfres, who is the Service Manager and Clinical Advisor to NHS England Integrated Learning Disability Services. That was a very long time.
And that's way too long, yes.
It is way too long, but I got there in the end, so that's the main thing. And we've also got Padmini Minia, who's the community nurse. Now, I know a lot of you. Give us a wave, Padmini.
Hello, good morning.
Good morning. A lot of you will know these people already, which is fantastic. I've also got the lovely Sarah here as well from One-to-One, who you all know, hopefully. So thank you for arranging this, Sarah. It's been brilliant. So before I start, okay, I want to ask you a question. Who of you knows what an annual health check is? And if you do, can you give me that famous wave, please? Yeah, we've got some waves. Fabulous. Okay, that's great. Thank you. Now, we're going to give you a bit of an overview what health checks are and what they involve, all right? And we're going to do a video if you're happy with that. It's only a couple of minutes, but it will show you an experience of someone actually having a health check. So I think it might be quite interesting, okay? But first, we're going to tell you a little bit more about it. Well, learning disability annual health checks start from the age of 14 if you've got learning disabilities, but they are voluntary, so the GPs don't have to do it. They get paid extra for doing it, basically. So it's not the same as the NHS health check programme for all adults, and it helps you stay well because it finds any problems early so they can be dealt with quickly. So it's really important that you don't wait till you're ill to have your annual health check. In fact, it's best to get them when you are fit and healthy, and it helps to actually to stop a premature death. So it really is important to get these checks done, okay? So how do you get one? Well, the first thing is to make sure that you are on the GP's practices learning disability register. Otherwise, they won't know that you can actually have one of these tests. Okay, then should be contacted by your GP to get an annual health check. That's a check every year. Okay, so what to expect? Well, it'll be a GP or a nurse that will do a number of different checks for you. They might check your weight, your height, your heart rate, your blood pressure, and take your blood or a wee sample as well. And they'll talk to you about how to stay well and anything you might need to help with that. And things like if you might have epilepsy or constipation or problems with swallowing, they'll talk to you about that. And about medications as well. And if your vaccinations are up to date. And if you have a problem with asthma, diabetes, they'll check to see how that's all going and how you're managing it. Is that a question for me already? No? Okay. So they'll check to see if you've got any other health appointments too. That could be like physiotherapy or speech therapy, and see how that's going as well. And ask if your family or carers are getting the support that they need too. So the GP should give you an action plan to help promote and maintain good health and prevent illness, which is what this is all about really, isn't it? Keeping you well and healthy. So there are some other tests that the GP or the nurse can do if you've got a specific health problem, okay, and that will be addressed in the actual session. So why is it important to have one? Well, most health problems are simple to cure if you know about them and to treat them. So your GP can help you stop getting a serious condition. Don't wait until you're ill. Let's do it while you're healthy, and we'll check how you're doing and catch things early so that you can learn how to stay fit and healthy, stop any illnesses before they become serious, and get help and support from the right people, and learn to look after yourself more so you can stay independent and healthy. That's all we all want really, isn't it? So things are a bit different during COVID, as we all know, okay? We all have to do things a little bit different to make it much more safer for the staff and for everybody that goes to the GPs and the surgeries. So They may do it now online, okay? And if you haven't already been offered one, do ask for one and make sure you're on the register. Always get that checked to make sure you're on the disability register. And then what you need to do is you need to, they'll wear a mask, you'll wear a mask. All the surfaces will be nice and cleaned down and disinfectants. Don't worry about thinking, oh God, it's not going to be safe to go to the GP surgery. We did a video about GP surgeries, and myself and my colleague Claire went inside, and we actually videoed how it would look and how it went, and it was really safe. So please don't worry. They clean and they clean and they keep things really safe for you. So don't worry, it's best to get checked out if you can. So everybody is going to be kept as safe as possible. It might be over the phone or it might be on a video, okay? But what we'd like to show you is the video. Now, this was done before the pandemic, before COVID happened. So they're not wearing masks in the video, but they will be in real life, okay? So please remember this is done before all the new things came into place. So Claire, would you be kind enough to now show us the video? Now then, let's go back to our list of questions that you very kindly sent in to us beforehand. So, one of the questions was, how can you get a health check if your GP refuses to give you one? So, who would like to answer that from our lovely panel?
I'll go, Jane.
Oh, Padmini, thank you.
Yeah, so you need to make sure that you are registered with your GP as a learning disability, and if you had one previously, there is no reason for them to refuse not having annual health check. You need to find out why are they refusing one, and if you can't find the reason, please contact Enfield Learning Disability Team or Jane herself, Healthwatch, or One-to-One Sarah, and we can look into it and find out whether you are registered or not, because I have the names on my list to see if you are registered with the surgery or not, and I can check your name to find out.
Yes, Padmini's been working very, very hard with all the GP surgeries
Yes.
to see if we can make sure that everybody gets access as much as possible for these checks, because it is so important. So well done, Padmini, for all your hard work. We do appreciate it. Thank you.
Yeah. So, and then of course, then if the GP still refuses after we've found out whether you are registered and you are entitled, then we would then have to go to the what we call the primary care organisation, that the local organisation, to find out why why they're not doing annual health checks. I think so far Padmini's working with all the GPs, and I think they're all accepted to do it now, isn't it? Or have you still got one or two that are saying no?
They were saying no previously, but last week I had meeting with them, and they have agreed with my support. So I'm going to support surgeries. I will be calling their patients on behalf of them, and I will ask you to book an appointment with the surgery, because now they have agreed to do it.
Yeah.
So you might get the phone calls from me with these particular surgeries.
Yeah, because you've contacted all 49 surgeries, haven't you?
Yeah,
you've worked with them.
I didn't contact the Python's because I'm the Python practice surgery at down at Highland Village.
Yes, so Elizabeth, I will be calling you from next week. You will be on my list, first list. I'll take your name and I will call you next week, because surgery has asked me not to call until next week, because they are doing it after many years. So we have agreed today, this morning, that I should call people around to go and book your appointment. So you need to phone the surgery when I call you. So they are sorting out their appointment books at the moment.
Yeah, so that's
Okay,
good.
my name's Elizabeth, by the way.
Oh, yeah, Elizabeth, I will find out your details. I probably have. If I don't have it, I will ask the surgery to provide me one, and then I will give you a call, okay? So you remember my name? My name is Padmini, and when I call you, you call the surgery, okay?
Okay.
Thank you.
Yeah, so just to let you know that, the GPs do get an extra money as well. So they call it the Directed Enhanced Service, called the DES. So this Direct Enhanced Service is it's extra on top of what they get. So they do get extra money for providing this service. So that, and they have to sign up for that, but it isn't compulsory. They sign up if they, it's voluntary if they want to. But now it seems that I think all GP surgeries are agreeing to sign up to it. So hopefully we should get a bit more cooperation from all the GPs.
Victor, you've got a query for us.
Yes, I have. Forest Road group practice. They're not being very helpful towards me.
In what way they are not being very helpful?
They're asking me questions that I really want to speak to the doctor about, and they, and they're saying that, I asked to speak to the diabetes nurse, that we have one there, and they wouldn't let me.
Okay.
I'm not sure what's happening with your scenario. If they think it is not necessary, then they may not allow you to speak to diabetes. If your diabetes is very well controlled,
I don't know. I don't know. I presume it is, but I don't know. But I mean, I haven't had a checkup or anything. Annual health it's just a waste of time phoning up the surgery because they want to know why I want to speak to a nurse or a doctor.
If they have no clinical ground for to see that you are not deteriorating for your diabetes, they may not let you do that. But I can't say on behalf of them why they are refusing to do that.
It's a pointless exercise, I mean, I can't even get a blood test, and I'm refusing to go to hospitals because I don't like hospitals.
What we can do, Victor, that's what you can always report these sorts of things to Healthwatch Enfield. We are happy to actually make a log of this sort of thing and see if any other people are experiencing similar issues.
Yeah.
So what we can do is make sure Sarah's got our contact details, and you can then have those. You can ring the office and get some more information. How does that sound, Victor? Is that okay?
Yeah, that'd be brilliant.
I think
it's just been ridiculous, and the reception.
Victor, I think the problem with them, since the lockdown, since this pandemic, it's just since this pandemic, unfortunately, there's a lot of services that are reduced, including GP surgeries. So they are they're prioritizing. So they're not all, that's the problem.
And they also,
I was seeing everybody like they used to. Hopefully that will pick up, but yeah.
And also,
I can't even go and get blood tests, and you say I don't want to go to hospital to do it.
Well, you're right to pursue it, but if you, like I say, if you come to us, we will discuss it with you and look at a best way forward for you, Victor. Is that okay?
That's fine.
Can I say something, Jane, please?
Sure.
So there are a lot of staff cut at the moment within the surgery. When I was talking to one of the surgery, half of the doctors are not able to work because they are isolating, quarantine, because their family members have been positive.
Yeah.
So there is a great extent of staff shortage with the GPs as well.
I can understand that. But the problem is, yes, the receptionists are not being really helpful. They're just being a right, excuse my French, a pain in the backside.
Yeah. A value on Susan, as she mentioned.
Yeah, absolutely, Victor. Yeah, so it's good to see what the situation is. That's fine. So there was another question which was about, can you go to another GP instead? So not your normal GP, but a different one. So who in the panel would like to answer that question, please?
So I'll go. So now almost every surgery has agreed to do annual health check. They would be doing it for themselves. If they have any problem, GP surgery can refer to another GP to go for that annual health check.
Okay, thank you. There was a question, I think. Was there a question? No? Yes? Galaxy. I can't hear you, sorry, you're on mute.
Hi, it's Victor again. There used to be a walk-in surgery when you couldn't go to your local doctors at Eagle House. They've stopped doing that now.
Right.
Yeah, they don't do the walk-ins anymore.
Yes, they're not around anymore, unfortunately. No. And there was a call from Galaxy. There was a query from Galaxy.
Hi, Sue. I think I've seen Pamini once. I think a long time ago. I think I've seen her at my doctor's surgery done on Trinity Avenue because my mum's on the doctor's hub meeting. I think she works in Chase Farm Hospital because she's on meet and greet. And I think I had a blood test a long time ago. And I think Pamini had me and my mum at the same time. And I believe everything that Pamini says about the thingy. I believe in it because I think I'm part of the board because she's on the hub thing. So she lets me know what's going on. So if I need one, I'll go with her down to the doctor's surgery.
Great. Okay, well, that's great that you've had that support. Fantastic. Okay. So another question is this just for adults? Well, the answer is it's anybody over 14, basically, with a learning disability who's registered with their doctors as learning disability. Okay. The next question is, how do we have one during the coronavirus time when we can't see a doctor? Well, we've sort of covered that. Yeah. Anything else anybody would like to add?
Yeah, I have. So.
Okay.
Well, I'm at Ordnance Throat Surgery, and I went down to Riley Hair Surgery to see a doctor there, and they were absolutely useless. But I went down to Evergreen to a walk-in clinic there, and I said, look, I've got this severe stomachache, and it was lucky I had all the medication ready, so I wrote down everything. I was called in, he said, what's the problem? I said, I've got this severe stomachache and the tablets I'm on are not working. He went, have you got them with you? I said, you're lucky. He said, why? I said, I've got them with me. I put them down, he picked them up, looked at them, he said, are you an asthmatic? I went, yeah. He said, the doctor should not give you these, and chucked them in the bin. He said, I'm going to give you something else. So he gave me something else. And he said, what surgery is that? I said, Ordnance Road. So he said, what I'm going to do is, I know someone who works there, and we'll transfer the new medication over. Okay. And today, I phoned up my GP and said, look, the stomachache is flared up again, almost flaring up again. He said, what I do is, this is how fast he done it. I called him at 10 to 10, and he said, by the time you get ready and go round there, it'll be waiting for you. I had walked all the way round to the chemist, which is about 10 minutes away, and my prescription was waiting. And all I've done was gave my name. And they said...
That's amazing, isn't it? When it works fabulous. And that's really nice to hear the good stories as well as the bad ones as well. So thank you for sharing that. That's really good news.
All I said was the name of the medication that I was taking.
Right.
And all he said was, he went like that, he said, oh yes, I know you. It's that...
that's good to know that there's a walk-in. Yeah, that's good.
And all I've done was, I just phoned him up and said, my stomach's flaring up again. And he said, I'll send the prescription on to your pharmacy. Goes round there, and it was waiting. And all I've done was gave my name, and that was it.
That's good.
He said, and the doctor said, if it happens again, and it still hasn't cleared up, phone me back and ask for me, and I'll prescribe you something totally different.
Okay.
And it only took 5 minutes on the phone.
Wow, very quick.
Thank you.
Very quick. So, we've discussed about how you get it. What about adjustments for people with visual impairments, people that can't see so well? How does that work with the annual health checks? Anybody able to help us with that one?
I'll go.
Hasmini?
So, if you are known to your GP surgery tends to make that adjustment automatically, but it's a good idea when you book an appointment, remind them that you need help with whatever you need help with, like you need extra time, or you need an interpreter, or you need support from your carers. You can just mention anything to your GP surgery and they will take into consideration. Thank you.
That's very helpful, because it's also things like translation and things like that. It's important that you let your GP surgery know what you need to access the services easily and well. It's really important, which is why you need to be registered as a person with learning disabilities. So that's the key thing, really, isn't it, to get these annual health checks? I think we'd all agree with that.
Yeah, and obviously if you've got a support worker or you've got somebody, a carer that's, you know, with you, they can also help you with that if you need help to be able to make sure that that's communicated to the GP.
Most definitely, most definitely. I mean, during COVID, some GP surgeries have got separate rooms set aside to do things like annual health checks or flu jabs and things like that. So if you're not sure, you can always ring your surgery and ask them. I know they're very busy with the flu jab at the moment, but it's still worth you investing in your health to make sure that you get the checks that you need, and that it's important to keep you well. Okay.
Yeah.
I think we've covered most of the questions so far. Are there any other questions that people might have about annual health checks they may be a bit nervous about, or want to find out more details, or anything we didn't quite explain well that they need to have explained again in a different way? Is there anything that we can help with? No? Okay, well, thank you, panel, for being so helpful. Obviously, you've really explained it well. That's great.
Can I just...
one.
Yes?
There is one. Right. Why is it? I just want to know why some GPs keep you waiting and others don't.
They have different capacity, Galaxy. Some surgery have many doctors and less patients. Some surgery are small, but they have enough doctors in them. It depends on their capacity, what capacity they have. And every surgery works different way. Some works very good, some are just trying their best to help you out.
Yeah, no, that's Naomi, by the way. So the Naomi, as you know, everybody's different. So, you know, and it's the same with the GPs. There are individual, different ways of working, and we'll have to accept that. We can't, you know, not everybody's the same. Not everybody works the same. It's just the way it is, you know.
But there's some great news. There is an easy read guide about annual health checks on the My Life website, the Enfield Council website. Yeah. So it might be worth having a look at that so you can read up about that, and explains it in detail to you. Okay, so it's I know that Sarah has the information and can share that with you, but it's an easy read guide on annual health checks on the My Life website of the council. Okay. There's also information on the NHS websites as well about annual health checks, and there's a link for that. So
Chris, do you want to add anything?
Any help questions, Chris?
Yeah, go on, I'll come with one thing. We do talk to doctors about this a lot. We do go to their meetings and sessions, and they always put their hand up to me and say, what's the point? What difference does it make? And I say, well, actually, there's one really big difference. we started this because we worked out people with learning disabilities die more often and younger than average. Since we started doing annual health checks, that difference has dropped. The death rate, people with learning disabilities, has dropped by about 1/3 since we started doing annual health checks. That's huge. Now, I can't point to individuals and say, you're the person we saved, because we don't know. But there will be people who identified diabetes early. There'll be people who identified a heart problem early. There'll be people who picked up a cancer early, who wouldn't have if they hadn't gone to a health check, and that would have died and would have added to our death statistics. So there is strong evidence that people going to health checks is saving lives, and it might be years. Go, just go. It's worth it.
That's a really good point, actually, Chris, because I think that there is a success story with these, and that's why they're so important for people to have them. So, do chase it. Do make sure you get your annual health checks, because you're worth it, as they say in the adverts. You're definitely worth it.
Can I add one more thing, Susan, to inform everyone that myself and Chris, we have prepared a pre-health questionnaire. So before you go to your annual health check, you need to fill it in. If you can't do it, you ask your carers or your parents to help you, and you take them with you to make your annual health check more effective. But we are waiting for the approval from NCLCCG, and once it's done, we will put it in My Life, where you can download it, fill it in, and take it with you when you go for your annual health check.
Yeah.
Okay, that's great. That sounds a really positive thing. So you got like a checklist.
It's like a checklist, yeah. So it's just sort of, because you've already completed it before, it just makes it easier. You can then sort of show that to the GP. The GP will have a lot of the questions already answered. So that will save time, but also save a lot of repetitive. So it's to help. And so when Padmini said NCL, she means North Central London. So what it is, we are part of North Central London, and North Central London is Enfield, Haringey, Barnet,
Camden
and Islington. So it's the 5 boroughs that are together called North Central London, and we're all working together to design this pre-health questionnaire, which Chris and Padmini already have one, but apparently North Central London have one too. And that I think they want to improve one that can be used all across North Central London in all of the GP surgeries across all 5 boroughs. So that's why it's taking a little bit of time. But once that comes on, like Padmini says, we'll put it on My Life and people can have access to it.
Yeah, and it is also easy read and it has pictures on it to make it easier for you to read and understand.
Yeah.
That's fantastic. That's a really helpful thing to have to take with you so that you feel confident in knowing what you can get help with. So that's brilliant. So don't forget, Healthwatch Enfield is here for you, and One-to-One is also very much here for you and has information on the websites about annual health checks. So if you're not sure, again, you can come and look at our links and at One-to-One's links. So before we go, I want to ask you a question again, which is, give me a wave if you think the session today was useful. Thank you. Oh, bless you. Thank you very much. And does anyone want to say about what they think about the session today?
It was very good.
Oh, thank you. So I've got a little hand. Oh, I've got little hands up as well. Thank you all so much. So thank you to everybody for coming and giving us your time. Really appreciate it. And seeing some of you again is fantastic as well. So I think we didn't put you off the first time round. We're really delighted. Special thanks to the panel. You've been so fantastic. You're giving us all your time and your help and support. I know that you know a lot of the people here today, but it's great for us to all see each other face to face, isn't it? It's really nice.
Yeah.
And of course to the lovely Sarah for allowing us to, working with us so closely and allowing this to happen today and making it happen. So thank you again for all your help to make this special session today actually come off. So thank you so much. So don't forget, Healthwatch Enfield is here. You can contact us by phone, email, social media, any which way. We are here to help you. So if you've got any questions about health or social care, do get in touch and tell your friends about the easy read documents. Tell your friends about One-to-One and all the stuff that's going on. And if people haven't already had their health checks or are not sure, spread the word. Okay, it's really important. We get this.
So, Lisa,
Yes.
I was going to ask you, you know when you said about the annual health check and support workers, I've got a support worker and I had a doctor's appointment up at Riley House. I phoned her up. This is how kind she was. I phoned her up. I said to her, I'll call her Jane Doe because I don't want to get her in trouble. I said to her, I've got an appointment, say like Monday at 10 o'clock. She went, well, hang on a minute, let's just check. She went to her boss and she went, do you mind if I transfer this person over to this person so I can come to this with this person to a doctor's surgery? They went, it's fine with us. She came down with me to my annual health check. There were some things that I didn't understand. I looked at her. She went, have I got your permission? I went, yes. And she answered the questions for me that I couldn't understand. And at the end, she asked me to fill a form in. And it said at the bottom, how useful was your support worker in helping you at the surgery? And I put absolutely excellent. I didn't know what to say, but she explained it on my behalf. And if it wasn't for my support worker coming from my doctor's appointments, my medicals and everything, I wouldn't have like phoned the surgery up and said, oh, my tablets are due or this isn't due. And she done it exactly how I'd done it.
I think a big round of applause to all the amazing support workers, I think, that help us, that keep us safe. So thank you to everybody. And I think that's a lovely story to hear. So thank you so much for sharing that with us. It's lovely to hear those sort of stories. So we've come to the end of our session. I can't believe it. Is there any last minute questions at all? Is everyone happy?
Yes, thank you.
Yeah. Okay, well, again, we've loved having you come to these sessions, so maybe we'll have another one another day. Who knows?
Yeah.
Okay?
Nice to meet you.
Lovely to see you.
Bye.
Lovely.
Bye.
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 Bye. Thanks, guys.
Bye.
Thank
you. Bye. Bye.
Bye.
Bye.